everything might not be fun.
The politicians keep saying, why is our healthcare system so expensive? And like, duh.
How does that make any sense? We'll figure it out.
This is the thing, I'm just getting totally unhinged now, and I don't know what to do. We're back in Patapsco Park, and I wanted to talk about MRIs. Everyone knows what an MRI is, and we want to talk about how MRIs are used. By the way, just you guys don't care about this as individual patients. But MRIs,
why not?
Because MRIs are costing our system a tremendous amount of money. Billions of dollars a year, and who makes money on the MRIs? Radiologists.
Okay,
radiologists are actually, sorry radiologists, but are actually one of the highest paid group of doctors in the country. And all they do is sit in a freaking room and look at pictures. Like my kids do that. They don't get paid that much. But so the more pictures they could order, MRIs are really good pictures for them because they make a lot of money in MRIs. I sometimes get x-rays back and it says, suggest MRI. Because they want you to get the MRI. So what about MRIs? This guy here.
But the radiologist doesn't order it, right?
The radiologist typically owns the equipment. They own the machine.
Okay, but...
They don't order it, but they suggest it.
So you're bringing this up because I wrecked myself a couple of months ago.
And by the way, just one more thing. The radiologists, they write articles about how everyone should get these things. You know, so they have guidelines so everyone should get, like mammograms. When people said people should get mammograms every 2 years, the radiologist wrote something back and said, no, every year.
Oh, really?
Yeah, they
I haven't ever gotten one.
They contradict, and we'll talk about that. So anyway,
yeah, so I wrecked myself a couple of months ago, and it's been so long.
Nobody knows what that means.
He
hurt my
messed
knee
up his knee. Now we all hurt our knees. We all do. But Mike plays frisbee, so most of us who hurt our knee, we just kind of run through it or whatever. But Mike's frisbee playing is a little different because it's twisted in and lots of stuff. And so he hurt his knee really badly.
So I want to know.
Lucy, come here.
I want to know if what I should be doing about it, if anything, or if I need to take it easy.
So that's what we're talking about. Is at what point do you get an MRI? And when I have people in my office like with back pain, they're constantly wanting to get an MRI. They come in, they say my back hurts me, I need an MRI.
That's because they can't see anything, and so the MRI they can see. I mean, people want to know what's going on inside them when they have pain.
Would you want that?
All I care about is if I can run, and so no, because if they tell me that I can't run, I won't listen to them. No, I don't.
So let's say.
Well, and there's a disincentive too. So if I remember right, so I asked you to order it for me, and you did, and I scheduled, and I think if I heard it right, even it's going to cost me $250.
Really, even with your insurance?
But that's because I have not met myself.
Oh, that's because you. Generally, it's basically free. It's free for
with insurance.
It's free for insurance, and it costs about $1,200 to get an MRI.
Okay.
So here's the thing: if you're getting an MRI, we're looking for a cartilage tear. That's the thing we're looking for. And if you have a cartilage tear, I talked to a runner yesterday who had a cartilage tear. She waited 6 months because that's what you should do. She did the smart thing, and she still couldn't run well, so she got an MRI, had a cartilage tear, had the cartilage fixed, did better.
Okay.
But getting cartilage fixed in most cases does not help it.
Right.
So there's a big study where they did MRIs, found cartilage tears, and the way you fix cartilage is you put a scope in. More people making more money. Usually orthopedists make a freaking fortune. I watched this procedure, and literally it took them 5 minutes. Okay. And they were chatting it up with people, having a good time while they were doing it.
Yep.
So put the scope in, you scrape out the cartilage, you get it back. So this study, they put in half the people, they put the scope in and scraped out the cartilage, and the other half, they put in the scope and did nothing.
Okay.
6 months later, exactly the same outcome.
Right.
And by the way, even the people who had the scope put in and did nothing did better than people who were in placebo, who did absolutely nothing. Just having the scope put in, they thought they were better.
Right.
And so they did better. So in most cases, if you get an MRI of your knee early on and you get it fixed, you would have gotten better anyway.
That actually happened to me.
Did it?
I had an MRI on my knee like 15 years ago, and they said, you have a meniscus tear. And I said, well, what do I do about that? And he's like, you could have surgery and have it fixed. And I said, okay, and I did nothing. And it went away. So then, here's a crazy thing. I got a call at home on the house phone for that Mark had to come in for his surgery the next day, and this is what he had to do. And I called him up and I said, your doctor's office called you because you have surgery tomorrow, by the way. And he goes, yeah, I'm getting my meniscus repaired. And I said, that's the dumbest thing I've ever heard. Just don't do anything and it'll get better. And he said, okay, I don't know, whatever. And then
he's a doctor.
He's a doctor. He didn't actually go through with it.
And he got better
and
too.
He totally got better.
But here's the thing: if you guys had gotten the surgery, you'd have said, "Yeah, the surgery fixed me."
Yeah,
right.
Sure.
That's what happens.
I'm sure.
Yeah.
I'm sure.
So like with back pain, everyone gets an MRI with back pain. But here's the thing: they have slip discs and bulging discs and spinal stenosis and hernia. Well, if they've done studies where they do MRIs on everybody who don't have any pain. And about 75 to 80% of people have bulging discs and slip discs and all that stuff. But the people who have pain and then go in, oh, now this is the cause. And then someone does an injection or something and all of a sudden they get better. So they've done studies too where people get injections in their back and people get fake injections in their back and both groups get better. So it's created this whole industry. It's created a whole industry of getting these tests. I had a guy who we know, who had terrible back pain, incapacitating back pain, and got an MRI and it showed a slip disc, and they scheduled him for surgery. And a week before surgery, I run into this guy playing basketball with his daughter. I said, are you still going ahead with surgery? He said, yeah, the doctor says I should still get it. He's throwing the basketball, and I begged him not to get a shirt to the doctor.
Did he wreck himself?
He didn't go for the surgery.
Oh, he didn't?
He didn't go for the surgery. He said, you mean I don't have to go for the surgery? I said, you're playing basketball. I said, but I said to him, I said, how long have you been better? He said, about 2 weeks. I got better all of a sudden. I said, you know, if you had surgery 3 weeks ago, you would have said, wow, this surgery is a miracle. Look how much it got me better. But meanwhile, you got better on your own. All these people get better on their own. So when people come to me and beg me, so what percentage of people, can you guess, with severe incapacitating back pains are going to be better in 3 months if we don't do anything?
Probably all.
85%.
Okay.
85% are better in 3 months. And a lot of people say, well, I want to make sure it's not something serious. Well, if something's serious, you have other symptoms. For instance, if you have a pinched nerve, your foot will be weak or it will drop. Or if you have cancer, you'll have weight loss, and you'll have other symptoms that go along with it, or a history of cancer.
If you have like foot dropper, you have all those things.
Then we better get it.
You got to get the MRI, right?
So pain itself, you might, and let's say in 3 months later you're no better, then we might get the MRI. In other countries in the world, they don't even let you get the MRI.
So what percentage of patients come to you with pain? Like, how long have they had their pain?
2 weeks, maybe.
Okay.
And they want that MRI.
Yeah, because you know why? They can't function like they're normally functioning.
But somehow they think the MRI is some miracle
that
will improve their situation.
No, they don't.
It is really cool science.
First of all,
it is cool science.
First of all, they don't think it's a miracle that's going to cure them, but it is a miracle, the MRI, that you can see what's going on inside, what's happening, and that's what they want to know.
Let me tell you something.
They don't come to you to cure them. They come to you to write the prescription to get the MRI so they can see what's going on.
Again, if I did an MRI or you, because you're a runner, and you've wrecked yourself. You know how you say you wrecked yourself?
Yeah.
You've wrecked yourself. If I MRI'd you anywhere, it would look like shit.
I'm sure it would, but
it doesn't mean
go through with any situation.
But it doesn't matter. You say, I want to know what's going on.
But
what I'm saying is, what's going on in your knee, let's say, is not what's causing your pain.
No, but what you can say to your patients is, I can order you the MRI, but I just want you to know, after you get the results, we can discuss what the results are, but you don't necessarily have to go through with what the specialist, says to do.
What if I say to my patient this, which I do? I say, I could order the MRI, but whatever it shows on you may have been there for 20 years.
Yes.
And we have no idea of knowing whether what we see on the MRI has anything to do with why you have pain. And then they always say to me this, then why are we getting the MRI?
Wait a minute,
And
wait a
they
minute,
always
wait,
say.
stop right there. So, his knee is really bothering him.
Right.
Okay? You see on the MRI that he has a torn meniscus,
Right.
let's say.
Yeah.
And you're going to say to him, you know what, I just want you to know that your torn meniscus that we see on the MRI doesn't necessarily mean this is why your knee hurts?
Or
Because that doesn't make any sense. You know
here's
what
what
I'm
yeah,
saying?
yes,
thinking-
yes. People have torn menisci for a long time, and so we don't know. It could be a tendonitis. It could be a lot of things. We don't know. And here's the thing: you've waited a while. You've had this pain for quite a while now.
A couple months, 2
A
months.
couple months, and so that's why we decided to get it. Like you tried other things.
And
you
I'm
tried
thinking,
medicines and rubs.
For me, it's going to change my behavior. I'm going to continue to run because that doesn't really bother it so much. And then, but I might drop the frisbee.
Yeah, well, see,
Oh,
that's why I'm getting the MRI. So he gets rid of this frisbee sport, and he can run a little bit more. So that's a good. To me, that's worth the $1,200 and the $450 you have to spend if you stop playing frisbee, and that would be really good because it's such a silly sport. Anyway, so I just wanted to talk a little about these tests because what you need to do when you go to your doctor is not just say, let's get the MRI in a knee-jerk thing, but that's
No
not
pun
a pun.
intended, yeah, right.
But before you get the MRI, have this discussion. What's the MRI going to show that's going to change my output? And is the MRI going to be confusing? Because let me tell you this is what people don't realize. I've seen people get surgery for things they found in the MRI that weren't causing the pain, and that surgery actually made them worse. It caused complications. So to look for, and then my older patients, I do an MRI, they got everything wrong in their body. They got masses here and nodules here and big blood vessels here, and it drives them crazy. They say, oh my God, I'm falling apart. And I say, yeah, I know that, but we don't want to know the details because your body's
Right.
taking care of it. The MRI is an amazing machine because it's so sensitive, but it's a crappy machine because it's so sensitive. It shows us stuff that the body is taking care of, that now we see and we think we as doctors
don't
should
have to
take
worry
care
about,
of.
yeah.
So that's the MRI. So anyway, let's go on with this run because we got
Yeah.
a long run. Hey, I hope you like the podcast. We'll be back next week. I'm going to give you some information. If you want to check the website, if you want to email me, if you got your own stories, let's talk about it. See you next week.